Hello, I'm Dr. Gonzalez, and today in this video we're going to talk about the following topics. We're going to get started with the facial foramens or canals. So starting here at the mandible, remember what you see here is an anterior view, okay? So this is the mandible right here, and this foramen, you can see number 155 is the mental foramen. Now look over here, this is the maxilla, and in the maxilla you can see this foramen number 136, it's the infraorbital foramen. This foramen right here, it's called the supraorbital foramen. In some instances, some people may have a supraorbital notch. Now let's take a look at the orbit. If you notice, the orbit has several foramens or canals. Also, we have fissures in this area. In the orbit, we have an optic canal, and if I pass this pipe cleaner, it's going to be in this area right here. So this is called the optic canal. If I turn around the skull, you can see it going into the internal vault of the cranium, particularly over the sphenoid bone. Now going back to the orbit, we also have this fissure right here. It's called the superior orbital fissure. And if I turn around so that you can see the internal vault of the cranium, you can see it right there. Also through the sphenoid bone. And if we have a superior orbital fissure, you have to imagine we also have an inferior orbital fissure. And it's inferior because it goes inferior. Last but not least, on the optic or orbit area, we have this canal right here. It's called the nasolacrimal canal or fossa. Now let's go into the base of the skull or internal vault of the cranium. So as you can see, this is going to be anterior, this is going to be posterior, and this is going to be lateral. Because this is anterior, remember this is the frontal bone, and right in the middle you have part of the ethmoid bone. So these right here, these structures that you see in the middle, it's where you have the cribriform plate with the crista galli. Now posterior to these two bones, you have the sphenoid bone, kind of in a shape of a butterfly. Earlier in this video, we already discussed the optic canal. We already discussed the superior orbital fissure, but we still have to discuss other foramens or canals. So the first one I want to go over is the foramen rotundum, and that's going to be this one, number 88. Foramen rotundum. The second one is the foramen ovale, it's number 89. And after I insert this pipe cleaner, I'm just going to rotate it so that you can see it also on this other view. So if we go back, remember foramen ovale, and number 90 is the foramen spinosum. Right? For short, I always tell my students that this is the ROS, like the store, ROS. Now also in this area we have the carotid canal. And we also have the foramen lacerum. I'm going to do final tilting so that you can observe the pipe cleaner exiting. Next is the temporal bone. Notice how temporal bone is on the lateral portions of the skull. So in the temporal bone, you're going to find the internal acoustic meatus. So the internal acoustic meatus would be right there. Number 111. Now, if we tilt the skull into a lateral view externally, this would be right here the temporal bone, and this is the external acoustic meatus, where the occipital bone, which is the most posterior one on the skull. So you can see this big foramen right here is the easiest one, probably. It's called the foramen magnum. Foramen magnum. Also, we have to go over the jugular foramen. So the jugular foramen is this one right here. Okay, number 57. And last but not least, we have the hypoglossal canal. For that one, you have to look inside or internally to the foramen magnum to spot it. Insert the pipe cleaner. It should be right there. And last but not least, if we tilt the skull so that you can see the posterior view of the mandible, you can find the mandibular foramen. Alright, that is it for this video. Thank you for watching. Don't forget to subscribe, like, and share. And if you have any comments or suggestions, you can leave them on the comments section. Also, don't forget to check out my Etsy store, Queen Mary Anatomy. That is it. I'll see you next time.